Good morning, Dr. Richard Buckley and team at MilfordMD. This morning's project is with a gentleman to take the chest, which has gotten big over time, and it can get big for a lot of different reasons, maybe no good reason, or maybe from some bodybuilding supplements. There are a lot of reasons, but in any case, the glands can get big, and the breasts big. Men have breasts as well. And then what do? We take the gland out, and we also, suction out the fat. Our patient's awake. He's calm, cool, and collected. Am I right? Mm-hmm. He says, yeah. And so I've numbed this side, and I also did vasoring here, which is a little ultrasound gadget. Looks like this. And that ultrasound bounces the pesky fat cells off of wherever they are adherent and stuck. And then we're going to be suctioning that out. When I'm done with that, I'm going to make a little zigzag incision at the bottom part of the pigmented area of the nipple areolar complex. So that's at the bottom of the areola. And we'll go in there and we'll find that gland that's big in there and making the nipple areolar complex protrude forward, which nobody likes. And then we'll get that gland out. And once you get the gland out, it's gone for good. It never comes back, which is a brilliant thing. And I'll level the tissues underneath and put some tiny little dissolving stitches in the surface of the nipple areolar complex. Our patient will be very happy and very excited, as are we. I'm here with Gabriella, Nurse Gabriella, who's behind the camera right now. Amy is scrubbed, and Greg is scrubbed, who's physicians. What do they call them now?
Associate.
Physician's associate. Your PAs in the past are physician's associates. Pretty soon they're going to be physician's advisors. That's be the next step. So he's working in New York, but gracing us with his presence. It's a lot of fun here today. So stay tuned. Maybe we'll bring you back, show you something more a little bit later. Thank you for watching another episode of Milford MD. Richard Buckley, Milford MD. Remember we did lipoing and vasoring of our patient's chest, and his right side of his chest now is very nicely flattened. We have this gland in here that we want to get out from underneath the nipple areolar complex, though. You can see this white stuff here. This is the gland showing itself. And if I pull this down and you look at the edges, you can kind of make out, I hope, that there's a zigzag here. So I made an incision that's zigzaggy, goes like this. And technically, I'm creating a W-plasty or an M-plasty, which refers, to the shapes. So by making that geometric incision and then subsequently a geometric enclosure, it gets very, very difficult to see these things in the future. They heal amazingly well. And if you just made a straight line, that's not a natural thing. So it's easier to see any kind of scar anywhere if it's a straight line. If it's a so-called curvilinear line, so it's a line with a curve, yeah, it's better, but it's still not as great as if we make a zigzaggy geometric closure. So I need to go in here now and fish out this gland, which actually extends all the way in here. And then after I found it, I will also trim it off on the top, leaving the nipple areolar complex, very nicely vascularized and healthy, and then I'll get that gland out. And as I said previously, once the gland's out, it's toast. It's gone for good. Yay! Woohoo! So, patients, you awake?
Yeah.
You comfortable?
I'm good.
He's good. Yeah, a man of few words, but he's good. Yeah, he's laughing now. So we're going to get in there and get this gland out. I'll just gently separate it and tease it and ease it on out. How's our time? What do you mean? Yeah, we good? We good? All right. That's a wrap. Thank you for watching yet another episode of Milford MD with team and patients.